Hello everyone, and welcome to excuse me. Welcome to this audio podcast. This audio podcast is part of the Interlobular branch, edition. This audio podcast is part of a SZtorm Communicade, and this audio podcast is part of a squadron G-Force. This audio podcast is part of a SZtorm Robotics production. In this audio podcast, a little bit of a intro to works, an intro to sort of peer-reviewed and published works from 2018, and sort of collaborative works looking at Henoch-Schönlein Purpura, HSP, and what can we learn? What can we learn from biomedical and clinical anatomy practice on this multidisciplinary disease? So Henoch-Schönlein Purpura, or HSP, is characterized by a triad of symptomologies. A triad of symptomology somewhat similar to hemolytic uremic syndrome, somewhat similar to hemolytic uremic syndrome, wherein Henoch-Schönlein Purpura and hemolytic uremic syndrome are linked are similar on the on the basis where there's a triad of symptomologies between in sort of both pediatric young people and young sort of adolescent conditions surrounding sort of the parenchyma and also in around renal pathophysiology. So Henoch-Schönlein Purpura is characterized by a triad of symptoms or symptomology. Number one, palpable purpura without thrombocytopenia. Number two, abdominal pain, and three, sort of arthritis. Renal involvement is also renal involvement sort of occurs in children, children or adolescents with HSP, and it is more frequent in those from male backgrounds. And in spite of its being a sort of self-limiting condition, HSP can cause renal manifestations with varying indices. Guidelines and treatment for managing care in such patients ranges between nephrology sort of nephrology and specialist nephrology sort of sites generally, and long-term prognoses depends mainly on the severity of renal involvement, which may manifest as persistent hematuria, proteinuria, nephritic or nephrotic syndrome, or even sort of more generalized renal failure or renal disease. To prevent or delay the sort of ESRD or end-stage renal disease, identification of early-stage nephritis is important, and the risk factors associated with sort of the renal involvement in HSP are not completely evidenced, although epidemiological and clinical features, as well as some abnormal laboratory findings, have been suggested to have a predictive role. The In around some of the defining features around HSP. There's its most common is where you have systemic vasculitis in pediatrics, in peds and young people or children. There can be vomiting, vomiting as part of one of the main sort of features in HSP. There's abdominal pain and gastrointestinal bleeding. There's alphalgias, where there's alphalgia or sort of joint pain. There's hematuria. There's proteinuria. There's nephrotic syndrome. And there's systemic small vessel leukocytoblastic vasculitis. There's purpuric skin lesions on extensor arms, legs, and on the backside as part of the symptomologies. And in the peer review publication, peer reviewed works from 2018, as there's a sort of an overview in regards to the criteria, if you like, in around the hospitalization for peds or young people with suspect or high risk for HSP. So number one, inability to maintain adequate hydration with oral intake, severe abdominal pain or significant GI or gastrointestinal bleeding, changes in mental status, severe joint involvement limiting ambulation and or self-care, and renal insufficiency, elevated creatinine, nephrotic syndrome, and where peds or young people with a suspect or high risk for HSP can have hypertension as part of the symptomology. That draws this audio podcast to a close, and this audio podcast is part of our interlobular branch. This as part of the interlobular branch edition. This audio podcast is part of a SZtorm Communicade or Communicade. This audio podcast as part of a Squadron G-Force, and this audio podcast as part of a SZtorm Robotics production.